Hi, I'm Merj, founder of Angel Connection. Today we're going to be with Olive, our marketing director. She's been with us and she's been serving the community for almost 2 decades. We're going to be discussing about transitional care, what it is, why it matters, and how it's going to benefit both the hospital and our clients.
My name is Olive Ibañez, the marketing director for Angel Connection. And today I'm very excited to be here with Merj to discuss about transitional care.
Patients do well in the hospital, but real recovery begins when they get home.
The goal is to make sure the transition to home is safe. Our caregiver can help the client follow the discharge instructions from the hospital. A good transitional care can help avoid hospital readmission. The hospital's team's goal is to have a safe discharge when ready. Collaborating with reliable in-home care providers like Angel Connection ensures the continuity of care.
Recovery doesn't stop at discharge. Recovery continues when they get home. That's why it's important for us to continue the care that was provided in the hospital. That's why it's very important for the hospitals to partner up with a good home care company like Angel Connection, because when the patient gets home, we make sure they're taking their medications, and we make sure that we also call the primary care physician for follow-ups.
Most families assume yes, but not always. Some insurance plans may provide caregiving benefits.
Actually, there's so many ways where a client can pay us, or many resources where they can pay for home care. Number one is a long-term care insurance. We've dealt with several long-term care insurance here in the United States, particularly Jan Hancock, Bankers Life, Lincoln, Genworth, to name a few. Number two is health plans. Olive was mentioning that nowadays health plans are starting to pay for in-home care support. Number three is medical groups. Medical groups are noticing the importance of home care company in the healthcare industry. Number four is the VA. TriWest, they pay a certain portion to their patients. Also, nonprofit organizations, they cover a certain portion for home care support. And last but not the least, private pay. The good news is we don't have minimum hours. We can provide 1 hour a day, 2 hours a day, 3, all the way to 24 hours a day.
That's right, Merj. The care is designed around the client's need, not the company's minimum.
Well, as we know, Olive, the care managers bridge the gap between the patient, the family members, healthcare providers, and the caregivers. They make sure that they supervise the caregiver, they coordinate the plan of care, they give resources to the family members, and last but not the least, they update the healthcare providers. So Olive, if our care manager coordinates the plan of care, our registered nurses oversees the plan of care to make sure that it's appropriate and suitable for the patient's needs.
Caregiver can help with personal care like bathing and grooming, medication reminders, light housekeeping, meal preparation, companionship, and transportation.
Our caregivers can also help with end-of-life care, transitional care, post-op or post-operative care, and Alzheimer's and dementia care.
Care can begin in less than 24 hours.
She's right. As soon as they sign the service agreement and we're done with the intake assessment, we can start the service ASAP.
Anyone from ambulatory to bedbound individuals who's needing assistance with activities of daily living.
We serve a wide range of clients of all ages, whether recuperating from surgery to dealing with the effects of aging, from chronically ill patients to terminally ill patients. But whatever the reason, we have the right caregiver in every situation.
At Angel Connection, we believe a great home care is never one person's job.
Because we don't just send a caregiver, we send a team. A caregiver who provides care, a care manager who coordinates the care, and a registered nurse who oversees the care. So those three important roles help the families feel supported every step of the way. And that's the Angel Connection difference.
Thanks everyone for watching. We hope to hear from you soon.
Well, it's a pleasure having you, Olive. Thank you so much. I hope you learn more about transitional care. And to learn more about our services, visit us at myangelconnect.com.